Watching the Senate floor during the debate over health care reform, I can't help but feel that some of my colleagues are a little confused. It is almost as if they've forgotten that this discussion is going on in America, not Canada. They don't want to talk about the 22,000 Americans who died in 2006 because they don't have insurance. They don't want to talk about the more than 500,000 Americans who file for bankruptcy after incurring unpayable medical bills. And they don't want to talk about the millions of other Americans who worry that they are one layoff away from losing coverage and one heart attack away from losing everything. No, they want to talk about Canada. Now, I'm not saying we shouldn't sympathize with our neighbors to the north, but I want to talk about how we can fix the health care system for the American people, for the people of New Mexico, since none of the plans we are considering would set up a Canadian system. Let's look at how we can pass an American solution to the problems faced by Americans. If you like the coverage you have, you should be able to keep it. And none of the plans we are considering would take away the options that Americans already have. But the status quo is not enough. We need to give consumers another option. We need to give them the freedom to choose a quality, affordable public health option. After all, what's more American than competition and choice? Even if our private market functioned perfectly, it would make sense to give consumers another choice. But our healthcare system doesn't function perfectly. Our system provides too little choice and too little quality at too high a price. Too many of America's healthcare markets are effectively monopolies, or at best, duopolies. According to a recent study by the American Medical Association, most American metropolitan areas are dominated by one private insurer, and others are largely dominated by just two. In New Mexico, the top two companies have 65% of the market. To put that in perspective, Dell, Compaq, Gateway, HP, and IBM combine for less than 54% of the U.S. personal computer market. I have to believe we can offer our consumers more than two choices of health plans. My state is a rural state, and in rural areas like ours, consumers often have less choice. They get to pay whatever the local health care plan wants or go without insurance. Insurance companies have used this monopoly power to offer less and to charge more. As consolidation has increased since 2000, insurers have raised deductibles and copayments without increasing coverage. And they have continued to make healthy profits while their customers struggle to keep up with rising costs. Premiums for employer-sponsored health care have almost doubled since 1999. But rising costs haven't hurt healthcare company CEOs. The top 10 CEOs managed to pull down $85.4 million in 2008. Even worse, what competition we have doesn't keep companies honest. Instead, they compete to avoid the poor and the sick. In New Mexico, an insurance company can charge a customer more because of a health problem from 5 years ago, or because he happens to be 45 years old and not 44. They can even charge a woman more because she might get pregnant. They have every incentive to do so. When a private insurance company turns down somebody who needs help, its profits go up. When it denies needed care, it has more money for its shareholders. That's a broken system. In New Mexico, we have seen the impact of unaffordable health care. Almost 1 in 4 New Mexicans is uninsured, and nearly half of our citizens have inadequate coverage. The vast majority of these people are employed, but they and their employers simply cannot afford coverage. A constituent of mine from Cedar Crest, New Mexico, wrote me just the other day to explain that she and her husband cannot afford to offer their employees health care at a small manufacturing company they own. The rates for small businesses like theirs are just unaffordable. And our high numbers of uninsured citizens cost the rest of us money. The average New Mexico family with insurance pays an additional $2,300 just to cover the price of the uninsured. $2,300. You see, if a New Mexican with diabetes has insurance, his insurance company can pay a small amount to have him receive routine tests and treatments from a podiatrist. But if the New Mexican is uninsured, he's less likely to receive checkups. As a result, he is more likely to miss the telltale signs of a circulatory problem and twice as likely to need an amputation. Diabetes amputations cost almost $39,000. And New Mexico did 366 of these procedures in 2003 for a total of $4.2 million. And when a diabetic has a limb amputated, the operation is only the beginning of the medical services he will need. For the uninsured, those costs fall on every family with insurance. Now, some of my colleagues admit that the status quo does not work, but they claim a government regulator can keep the private HMOs in line. We will not need more regulation if open competition can be more effective. Others just claim that a public health care option won't work, but the evidence suggests otherwise. Experts have developed a number of viable plans to give Americans the choice of a quality, affordable public option. More than 30 state governments offer their employees a choice between private insurance and a state-backed public option, including my state of New Mexico. These states have not found this strategy unworkable. They have not seen either public or private coverage dominate the market. Their employees just have another choice. What would be wrong with that? The truth is that this Congress has a very simple decision to make. We can stick with our current system, or we can give Americans another option that guarantees quality, affordable care. Opponents of reform don't want to talk about that decision, so they talk about Canada. But the decision before us has nothing to do with Canada. It is about the American people. They have been stuck in a broken system too long, and it's time to give them another choice.